Thank you so much for joining us this afternoon. I think I know everyone on the call, but I'm Ray Pucci. I'm the president here at the Delaware County Chamber of Commerce, and I'm really thrilled to be able to offer this webinar to you today. We've been, ever since the advent of the Affordable Care Act, we have been looking for solutions, alternatives to offering the type of healthcare programs that we did in the past. And honestly, I think we've come on one. Through our partnership with the Small Association Leadership Alliance, we're really pleased to offer a new healthcare solution, not health insurance. It's a healthcare solution that we think is going to be of great interest to, particularly to small businesses here in Delaware County. And Rich and Justin are joining us. They're our national partners in this effort. And I'm real thrilled to introduce to you Rich Lawson with the Small Association Leadership Alliance, who will take us through what this program is. Rich, all yours.
Okay, great. Thank you, Ray. And thank you, everybody. Really quick, some housekeeping. If you'd like to ask questions throughout the presentation, please drop them into the chat or Q&A. And we will try to get to those questions as we go along. And then I'd also like to just let you know that Justin Schechner from the Aries Group Benefit is joining us today, and Justin will be discussing kind of the catastrophic major medical side of the program, and I'm going to be focusing on the preventive care side of the program. So we'll be having Justin take over here in just a moment. So let me bring up my slides, and we will kick this off. Okay, so as Ray mentioned, we're the Small Association Leadership Alliance, and we're a national membership organization like the Chamber, and our members are other associations and chambers of commerce. And one of the programs that we've developed is the SALA Healthcare Program, which we'll be discussing today. So let's just jump in. The reason why we're doing this is kind of illustrated on these slide bullet points, if you will. A lot of associations like the Chamber here are looking for alternatives to traditional insurance. And the goal of this program is to reduce monthly costs. As you can see there at the second to last bullet, we often see 50 to 60% savings over your monthly costs, particularly if you're not eligible for a COVID subsidy or something like that. And even if you are looking at the state exchange and the prices are comparable, which would be the case if you're on some sort of ACA subsidy, oftentimes the deductibles are extremely high. So the second part of the program, which Justin will be talking about, really the out-of-pocket costs and the deductible options are very manageable in the program. And we also like to highlight the last bullet there. We periodically go out and survey participants in the program across the country. And we're obviously very pleased that we have a 91% approval rate of folks reporting being very or extremely satisfied with the program. So we're going to be talking about the preventive care side of the program, which is offered through eBenefits administrators. And you have two choices of preventive care plans with them. And then Justin's going to be talking about the empowering benefits, medical cost sharing for your major medical accidents, illnesses, and hospitalizations, and so forth. There is also a dental plan add-in, which many take advantage of, and we can touch on that a little bit too. So the best way to understand the program, because it does operate a little differently than insurance, is to think about your care in three silos. So on the right side, you have kind of the pure play preventive care as defined by the 80 preventive services under the Affordable Care Act. For those 80 preventive services, there's 100% coverage with no copays in both plans. And then in the middle, you have your day-to-day stuff. So maybe it's a sinus infection or the flu or twisted ankle, that sort of thing. And then on the right side, you've got the big stuff. So cancer diagnosis, car crash, blown out shoulder or knee, trip to the ER, surgeries, things like that. And that's what Justin's going to be talking about with the empowering benefits side of the program. So let me jump into the two options for your preventive care. The first is called the Essential Plan. And as I mentioned, it has 100% coverage for the 80 mandated ACA preventive care services, zero cost, zero copay, so all included. And it does have a very robust virtual care benefit from an organization called Recuro Health. And Recuro was started by the person who founded Teladoc. So you may have heard of Teladoc. So it operates in many of the same ways, but it adds a primary care service. So virtual primary care, it's sort of the cutting edge of all this stuff. And there's also behavioral health built in. So you have those two additional benefits in addition to your normal sort of urgent care. I'm not feeling well. I just want to talk to a doctor on the phone and have him hear it out and maybe call me in a prescription or something like that. There's no cost. It's unlimited use, $0 copay for the Recuro Virtual. Now, the thing to remember about Essential is this is your lowest cost option. It's just the preventive care and the virtual care. So there's no copays for a trip to your primary if you've got the flu or you want to pop into the urgent care with the twisted ankle scenario or something like that. And there's no prescriptions. So the person we see most typically in this enrollment is somebody who's young or I never get sick. I don't like to go to the doctor. I just want to pay the lowest amount. Or it's going to be somebody who is really into the idea of a health savings account. And this is structured as a high deductible healthcare plan, so it can be paired with an HSA. So an HSA is like a cafeteria plan or flex spending account, except for you don't lose the money at the end of the year. It accumulates, and it can be converted into an IRA. So some folks will use the HSA as a retirement planning investment vehicle, knowing that if they need to go see the doctor for the flu or something, they'll be paying for that out of their HSA savings, not through the Essential plan. So here's a little slide on the HSAs. It can be used to pay for qualifying medical events, and the contribution limits are down there at the bottom for 2024. So you can really put away a lot of money. And like I said, unused funds will roll over at the end of the year, and your savings grows tax deferred. So that's option one. Option two is the Summit plan, and we get probably 80% of our enrollments into the Summit plan. And the reason why is it has the same 100% coverage for the 80 ACA mandated preventive care services. It has the same Recuro Virtual Health, but it's got your prescription drugs and it's got the copays for stuff other than the preventive services. So you can go see your primary care doctor for the flu. You can go to a brick and mortar urgent care. It's got labs and imaging specialists, all that bundled in. So this is the more traditional approach that you'll use if you have, the things like if you're on prescription meds like cholesterol or high blood pressure, you certainly want to be in Summit because you'll need the prescription drug benefit. This slide shows the copay structure. It's $20 for primary care visit, $50 for specialists, urgent care, labs and imaging, and $200 for CAT scans. On the prescription side, it's got a very good prescription drug program, particularly with generics. There's over 800 meds that are a $1 copay. Some are even $0 copay. My cholesterol med is a $0 copay. There are no monthly or annual limits on tiers 1 through 4. Where it gets a little tricky is in tiers 5 and 6, which are your brand name meds. So if you're on a brand name med or you are interested in knowing what the costs are through the program, you can just email me, and I'll have my email address here at the end, and we can look the meds up in the formulary and get you an idea of what the coverage would be. But there are other alternatives, of course, and we often will direct people towards GoodRx Gold or provide assistance for manufacturers' discount savings cards, which are often available for the newer brand name meds. So there is a level of service if it's not covered within the prescription drug program, and we're happy to assist with that. So here's a slide on Recuro. As I mentioned, it's got 3 components. It's got primary care, which is what's highlighted here. And with primary care, you select a physician. It's not a random physician. You actually develop a relationship with the physician. It's all done online. They will mail to your house your basic lab tests. And then for much of your primary care, you can just take care of that virtually. The urgent care is like what you're probably familiar with, where you can go through the app or through the website and set up a call or a video chat with a doctor. I've personally used that service 3 times, twice traveling, and it was really good. I was on the phone with somebody in about 15 minutes in the state that I was in. So they were authorized to write scripts in that state, and they actually phoned them ahead of me to my next stop, where I was able to pick up the medication, and I was very, very pleased with it. And then there's also behavioral health component, which we were excited to see added last year, because behavioral health is often neglected and you don't see it often in different insurance and healthcare offerings. So that had been a weak point. It's not full psychiatric, but it is on-demand counseling, which certainly fills a gap. So eBenefits uses the MultiPlan PHCS network. So MultiPlan was started by United Healthcare. There's over 900,000 participating physicians nationwide. I don't expect there would be any problem finding in-network providers in your area. If you've got a physician that you really like that's not in MultiPlan PHCS, there is a nomination process. We can assist you with that and getting them added in. At the very worst case, you're going to get 125% of the Medicare rate for going out of network. So it's not a no coverage if you're not in network. It is at least 125% up to an in-network rate. So again, if you have any questions about that, you can also email us. We can run directories for you, and it'll give you a list of all the different options for your zip code and surrounding areas. So cost. Justin's going to get into the cost a little bit on the second component, which work together. You wouldn't enroll in one without the other, because the benefit's not going to handle anything in the hospital or anything kind of on the catastrophic side. This is strictly your day-to-day and your preventive care. In the left column of this slide, you'll see an individual enrollment, individual and their spouse, individual with kids, or the entire family, spouse and kids. Center column is your monthly pricing for the essential. Again, that's the bare bones, 80 preventive services plus the virtual care. On the right side is the monthly cost for Summit, which includes the copays and the prescription drug benefit. So now that's going to move us over to Justin. I'm going to stop here and unshare my screen. And Justin, if you can take over, we'll let you discuss the other half of the program.
Excellent. Rich, can you see my screen?
Yep, all good.
Excellent. Well, thank you everyone for joining us today. As Rich had mentioned, I'm going to be presenting the second part of the program through Empowering Benefits. And the plan is called the Care Plus Health Plan. This plan is mainly for your catastrophic type items, meaning surgery and hospitalization. There are a wide variety of services and resources as part of this plan, but the core of the plan is medical cost sharing. Medical cost sharing consists of a large community of health-conscious individuals who voluntarily contribute to a monthly share towards each other's healthcare expenses. When members have a medical need, they are responsible to pay an initial unshareable amount. They may select from the following amounts, either $1,000, $2,500, or $5,000. And after those amounts, the medical cost sharing community shares 100% of the members' remaining eligible expenses with no cap. There's also a maximum of 3 IUAs per year in a rolling membership period. And if there are any further medical needs, members are responsible for the first $500. However, if that need is more than $500, that is waived. So just as an example, if you choose the $1,000 initial uninsurable amount, you have you're hospitalized for something. You are only going to pay the first $1,000, and then everything over that will be covered at 100%. A few months later, you need a shoulder surgery. Again, you're only going to pay the first $1,000. Everything else will be covered 100%, and there will be a third one, so you get three events per year. So in essence, with the $1,000 plan, you're essentially capped at $3,000 per year, or for 3,000 or 3 separate $1,000 events. The $2,500 plan, $7,500 or 3 separate $2,500 events, or the $5,000 plan, $15,000 or 3 separate $5,000 events. The medical cost sharing part of the plan is through a company called Zion, and there is a membership guidelines on the chamber website that discusses what is included and not included in sharing. There are some exclusions for pre-existing conditions, etc. In addition to the cost sharing piece, Empowering Benefit also has a concierge assistance program, and they can help you navigate any of your medical needs. Because a lot of times when you have a high cost medical need, like a hospitalization or a surgery in particular, you're going to want to go out and find the fairest price medical services for providers and medical services, etc. They also will give you access to something called Care Connect, where they partner with the team. And again, for surgery, they'll find the best negotiated and lowest possible price for that surgery. The plan also does come with telehealth, but it is a little redundant. I mean, everything comes with telehealth these days, especially since COVID, but you can get that through the e-benefits plan, or you can use both if you choose to. It also comes with a membership assistance program, which is comparable to an employee assistance program that you might have through a company. And they do offer mental health counseling and assistance with life work related issues. And that offers up to 12 virtual face-to-face or telephone sessions with a counselor per year per person on the plan. Two final benefits of Empowering is if you are interested in alternative medicine, such as acupuncture, massage therapy, natural healing, they do have a partner called Choices by Whole Health Living that gives deep discounts for many of these providers that offer these services. And finally, it comes with a medical records vault and QR life code. So if you have a medical emergency, you can get this vault set up. So if you have another medical need, another provider can get into it safely and look at your medical records as needed. So that pretty much wraps up the plan itself. Regarding the rates are age banded. So there are rates for the 1,000, 2,500, and 5,000 IUAs for ages 18 to 29, ages 30 to 49, and ages 50 to 65. And as you can see, I mean, unless you're able to get a very large subsidy on the exchange, these rates are much more competitive than major medical coverage as far as price. That concludes my presentation. Rich, did you want to open it up for questions?
Sure. I'm going to go ahead and, if you can unshare, Justin, I'm going to go ahead and bring up the association website so sure. We can we'll kind of walk them through the resources that are available there. So let me see. That should be up now. Okay, so this is linked. Ray has this link through the site, and if you come here and you click on the Sale of Healthcare Program tab, you'll have these blue boxes. And if you expand them, you're going to get all the program documentation and rate sheets and all that. So here under e-benefits, you've got the scheduled benefits and the brochures, information about the telehealth stuff, how to do a network search. Then you have the empowering section here with all the various program documents that are available. Justin's contact information if you want to get a hold of him offline. And then the Recuro thing is repeated here, and some of the other benefits that are available through Empowering. And then finally, the dental information. So there's a brochure on dental here, and the pricing is here at the bottom. And the dental uses the Aetna dental provider network. So you'll want to check to see if your dentist is in network or if you have an option there in network as well. So that's just a quick guide on how the website works. Then finally, so the program is very flexible and it's rolling enrollment. So you're not subjected to a open enrollment period. You can come in at any point during the year. You can leave at any point during the year. If you're involved with coming in through a business, there's no full-time requirement. So it's available to full-time, part-time, seasonal, even 1099 folks if you wanted to do that. You can enroll directly into the program, or we can set you up with a list bill, which consolidates the billing through the company, and everybody is invoiced together, and the payments are applied through a business bank account. And like I said, it's really an opportunity to reduce costs. And so you're probably looking, Justin, maybe you'll weigh in here, but I think overall it's probably 50% savings is about what we would see depending on where you are in the country. And we do have that dental option. If you, I kind of just went through all that. So let's go here. So this is the email address, hpsupport@smallassociations.org. You can go ahead and email us there. It'll come in through the help desk, and somebody will grab the ticket and get back to you. And we can do a one-on-one call, talk about the pricing of any prescriptions you're on, any impact with pre-existing conditions, or anything like that. So that kind of wraps it up for me. And yeah, if we'd like to field some questions, Justin, happy to do that. If you guys want to just drop in any questions in the Q&A or chat, that'd be great. We can answer those now. And again, if you'd like to go offline and have a one-on-one, we can absolutely do that as well too. Or if you're interested in setting it up for business, there is a little short process for that. It'll take about a day or two to get it turned around for your company.
Hey, Rich.
Questions coming in. Yeah.
Rich, it's Ray.
Hi, Ray.
What are those next steps? If someone is interested, they read through all the documentation, see what the savings are, decide, yep, this is a package that's going to work for us. What's the next step that a company would need to do?
Okay, so two things. If you're a company, you should email me, and we'll get the list bill form to you, and it's just a one-page thing. It's information like your address and your tax identification number, what bank account you want to have payments applied to, basic things like that. You'll also get copied on enrollments, and you'll have access to reports so you can see, which of your employees are enrolled and what products they're enrolled in. So things like that. It's pretty simple. Like I said, it's a 1 or 2 day turnaround. The key date you need to remember is the 18th of the month. That's generally the cutoff for new enrollments. So any enrollment or change request, like a dependent add or delete, or a cancellation that's received before the 18th will be processed for the first of the following month. So enrollments prior to December 18th, for example, will be active January 1st. After that, it would roll to February 1st. So that's kind of how it works with a business. Same rules apply for individuals. If you're an individual and you just want to enroll, on the Chamber website here, you see this Enroll Now button. You'll just enter your name and email and phone number in case we need to get back with you, and that'll start the process. And you'll get the links to enroll on your preventive care plan as well as the empowering benefits enrollment. And you kind of set that up to go through a bank account of your own for the monthly payments. Well, it looks like we did a good job, Justin.
Yes, usually it's either a good sign or a bad sign if there are no questions.
Either. There we have something in chat. Okay, good. They might be lengthy questions. Oh no, Jeanette says thank you for your time. Have a wonderful holiday season. Thank you, Jeanette. I appreciate that.
Same to you, Jeanette. I see something popping up right now. Oh no. Okay. You can all always reach out to us directly if you want to have a one-on-one and ask any other questions that you may have not wanted to ask on the call or you did not think of right now.
Yep, for sure. Absolutely happy to do that.
Well, Justin, Rich, thank you both so much for the information this afternoon. Rich, you're going to be sending me the video of this, and we'll be sharing that with everyone who did register for this webinar, and of course I'll post that to the Chamber's website, as well. So it'll be an on-demand video kind of thing for folks to view and get more information.
Yep. Yeah. Thank you, Ray, and I'll get that hopefully out to you this afternoon.
Wow. Great. Thank you.
Well, I appreciate everybody joining, and we can go ahead and give you back the balance of your day. And thanks for spending some time with us.
Thanks, everyone. Have a great day.
Thanks, folks.